before we continue our discussion, let's take a look at this week's nutrition in the news. And then I promise, Dr. Contreras, you're going to get to finish your story.
About his aunt.
About his aunt.
Well, today's news is to chemo or not to chemo. Recent studies suggest that breast cancer patients can choose a gentler form of chemotherapy or skip it altogether without harming their chances of overcoming the illness. Currently, chemotherapy is recommended for women with breast cancer that has spread to the lymph nodes, which amounts to about 45,000 women each year in the United States. However, the chemo might not help most of those treated. Very interesting. One study found that a gene test can predict a woman's risk of recurrence and concluded that as many as 18,000 women each year could safely skip chemotherapy. Wow. I would hate to be one of those 18,000 who just heard that.
It's probably more. We already know from many studies that chemotherapy, although it does reduce tumor activity, tumor mass, it does not prolong the life of women. And many of those months
What's the goal?
Yeah, why do it then?
The whole thing is philosophical. The philosophy of orthodox therapy is to reduce tumor mass. The rest is unimportant. Our philosophy is to treat the patient.
And
it changes, exactly, it changes everything.
And try not to so much influence their quality of life,
And
right?
what we have been able to find over many, many years, and many doctors now in America are beginning to realize, is that we can actually convert cancer into a chronic disease.
Wow.
You see, it doesn't, if you were diagnosed today with diabetes.
Can you explain that? I think.
If you were diagnosed with diabetes, you say, bummer, you know, I will have no cakes, but you're not going to measure yourself up and see where you're going to be buried.
Right, exactly. It's something that can be managed.
It's an incredible difference.
Right.
So hopefully if somebody would tell you you have cancer, you would think the same, because it can happen. Our aim is to maintain our patients alive for an indefinite period of time. God only decides.
Right, God decides.
And we have been able to do that in a large percentage of our patients, so that they're not cured, but they couldn't care less.
Now, does this rule about the chemotherapy, does this apply to all cancers? Or are we
most
of them?
Right now, we're gathering the information because there's so much money into cancer of the breast.
Sure.
And I am really surprised that they came out with this study, but they probably had no choice, because this information has been known for a while, and so you cannot keep it.
You're saying that because of the bottom line, the medical community would withhold this information so women would keep on getting chemotherapy?
Just not to change the status quo, because the money is coming in. Yeah. Unfortunately.
That's sad, but it's true.
It's money too, but isn't this what American doctors are up against? They go to school, they go to medical school. In that, they get protocols.
Yes.
They get protocols for cancer treatment. They get protocols for surgery. They have to stay within that protocol.
Right.
If they're dead set against it, because otherwise they find themselves in a court of law all too often. It's not for traffic tickets.
And it's a shame. I can tell you, because I studied in Mexico, in the States, and in Europe through my career, and I can tell you that the best schools of medicine are in the United States of America. But then you're finished with all of this incredible knowledge, and all you can do, which is extremely frustrating, is do cookbook medicine. You have to follow a protocol. So these incredible doctors that are incredibly well trained, then
they
have to go by the book. Wow. It is extremely frustrating, and hopefully it will change soon.
And
I'm sorry, go ahead.
I was just going to say, and that's why that many people do make the choice to go to a place like Oasis of Hope.
Yes,
and CTCA, Cancer Treatment Centers of America here in this country, they do treat the whole person, but I think they're still restricted in some way, whereas if you go to Mexico...
Quite restricted, but less and less, fortunately. Now, in Mexico, the structure of the government, in order to restrict doctors or unrestrict doctors, is extremely different because of our lack of resources. In Mexico, half of the population lives in poverty. So we are trained to provide the most inexpensive therapies to our patients, and most of those are natural. And so our government is very open and allows natural therapies, and our FDA will approve them. Whereas here in America, that could never happen.
Wow. Too much red tape.
Well, it's not only that, it's within the system, you have to have a patent. And in order for you to get a patent, you spend millions and millions of dollars. If not, you will not make your investment back. In Mexico, the government says, hey, whatever you can do that is not expensive, we'll give you permission from our FDA to do it, because we have so many people that have no money.
Well, that's really fascinating. I want to go to some of your alternative treatments, but first of all, we have to hear the rest of the story about your aunt.
Oh, well,
she psychologically, she was like psyching herself out to still be sick.
Exactly.
Right?
She was still a victim of cancer. And just to give the flip side of the story, I have this very young, yuppie guy from New York, a lawyer, 35 years of age, and tells me his story. He's riddled with cancer, and I begin to give him a pep talk, and he says, "Oh, doctor, you don't have to encourage me. Cancer is the best thing that ever happened to me."
Why?
Why? Well, I used to work 18, 19 hours a day, forgot about my wife, didn't know my children, get the diagnosis of cancer, and I suddenly see life in a completely different way.
Wow.
I appreciate now what God has given me. I watch every sunset now with my wife, now that I know that I only have a few months to live.
Wow.
I play with my children all the time. Cancer is the best thing that ever happened to me. So you see, getting rid of cancer is not being free of cancer. This
what
guy
happened
was
to your
already
aunt?
free. My aunt is still doing very well, and I told her, what you need to do is release this to God. Because when the cancer is driving you, it's going to kill you, even without
Wow.
a malignant cell.
Wow.
And so spiritual fortitude is the only thing that can save you. And that is why at the Oasis of Hope Hospital, the first thing that we want to do is present the person of Jesus Christ to our patients, because that is your only release of cancer, whether you have it or not. And that's why we are able to see so many patients that were given a few months to live to be alive 15, 20 years later, and the cancer is still there.
Wow. But you've maintained it.
Yeah, they were able to maintain, like you say, a balance.
Wow.
It becomes chronic, but anybody will take that given the option.
Yes,
Of course.
given the
Let me
option.
touch on something which is might come across as a little aggressive, but I know our viewers are probably thinking this, so I'd like you to talk to it. And I'm sure you address this in your book, Hope, Medicine, and Healing, but people hear about hospital in Mexico, you keep mentioning Mexico, and they might be thinking, he seems like a great guy, he's certainly smart. Is this hospital 21st century technology? Is this hospital 21st century hygiene? I happen to know that it is, but I'd like you to address, because I think, if I could say that without coming off the wrong way, I think people are
concerned. Yes,
they're concerned.
We have a hospital that complies with all of the standards of an American hospital. We are members of the American Hospital Society
Really?
Association, and precisely to address that. And we have patients from all over the world come to us and have come for the last 45 years. Last Christmas, we had, I think, 13 countries represented in our
Wow.
in our Christmas.
Do you find, Doctor, that you're getting patients any earlier? I know, because I've known you for about 15 years, and when I say getting them earlier, as your hospital was growing and becoming more well-known, people would so often come to you as a last
Yes.
resort, carried into the hospital
Yes.
or whatever. Do you find
the
it?
percentage has improved from about 1% to 15%. Still, most people are looking for alternatives when they hit the wall. And our statistics do show that the patients that come earlier fare much better.
Good, of course. Well, in the amount of time we have left, I want to talk about some of the treatment options that you offer in your book. Is cell redox regulatory therapy one of the treatments?
That is a very important subject, because we know that cancer is very liable to oxidative stress. But in general, we want to keep our bodies antioxidated. That's why antioxidants are so big.
Yes.
But when you use vitamin C in very high dosages, you will provoke oxidation within the tumor and antioxidation to the rest of the tumor. So we have been using very high dosage of vitamin C to kill tumors, and it kills them in a similar way to chemotherapy without any of the side effects.
Wow.
The amazing thing, Shirley, is that all of these theories have been developed at the NCI, and no American doctor is doing it. We're doing it in Mexico. It was, when the theory of vitamin C started in the 70s with Linus Pauling, he had the wrong idea. He thought that antioxidation was killing the tumors. Now we know that it's oxidation. And when you manipulate that with protecting the rest of the body from that oxidation, we're finding out that we can use vitamin C effectively as chemotherapy. And hopefully in the near future, we will be able to fine-tune this therapy so that we don't ever have to use chemotherapy again for any type of tumor. But in cancer of the breast specifically, it's working wonderfully.